Hi, everyone. I'm Mark Belkin, advanced heart failure cardiologist at the University of Chicago. I'm excited to be the chair of the newest American Heart Association scientific statement called Standardization of Baseline and Provocative Invasive Hemodynamic Protocol for the Evaluation of Heart Failure and Pulmonary Hypertension. I'm excited to have done this with Dr. Marat Fudim.
Hi, Marat Fudim. I'm one of the heart failure cardiologists at Duke and co-chair on this scientific statement. So this paper is going to be published in Circulation Heart Failure. We encourage you certainly to read it and utilize the information provided. Maybe, we start off, and this is intended to be conversational, we start off on, how this actually came about. And one way that came about, or one of the reasons it came about, is that both of us are actually spending plenty of time in the cath lab, a different institution in Chicago, and for me it's in Durham, North Carolina, where we do a lot of invasive testing, whether that's resting, provocative testing, with exercise, without. And we came to recognize that there is very little standardization and very little training provided in the clinical setting of a trainee in the space of cardiology, or even during residency, that helps us internalize many of the whys and hows you do this, and then also how to interpret the data. So the clinical council at the American Heart Association actually proposed to do a standardized framework around invasive testing and the interpretation of the data, and assembled, what is, I think, a pretty astute group of authors to write this document.
Yeah, and this was coming up a lot. I talked to Marat a lot about how he does caths, how whether it be at rest or with exercise, different provocative studies with different drugs, and you look through the data. So as we were doing this, we were thinking about let's use lower norms have nipride or vice versa, and then you start looking through the data. And there actually is different studies have different protocols that they're using. Some of them are hard to find actually what the actual protocol was, not just that they use them. And you realize there was actually I would be asking, or I'd have trainees ask, how are we doing this exactly? Or honestly, the nurse in the cath lab, what is the exact plan? And so, as director of our hemodynamic laboratory, I was trying to put together protocols, and I assumed that there would have been already a scientific statement actually that listed this out. And that was not there. And then in our conversations, we talked about it'd be great to get a lot of the leaders in the field who practice in the cath lab to help put together essentially not just best practices for measurement and interpretation of hemodynamics, but also how do we do these provocative protocols as it relates to fluid, vasoactive drugs, exercise, things like that.
And hemodynamics, in the past were important. I think they're getting increasingly recognized as relevant in our clinical care, inpatient, outpatient. It's utilized frequently in clinical studies. And so I do think that, unfortunately, despite its importance, we don't really get formally taught how to do hemodynamics, and often, the right eye catheterization get poo-pooed as, the bystander to the left eye catheterization, which is absolutely not true and infuriating sometimes. So I do think that a document of this nature was sorely needed, did not exist, as you pointed out. And the authors we assembled, the important part is that we have early career investigators, senior investigators, but all the people participating are actively participating in the space of hemodynamic testing in the United States, in Canada, in Europe, in Japan. So I think we wanted to have a broad representation, because what might matter to us in my cath lab, in your cath lab, might not be the same in other parts of the country or even abroad. So I do think we try to standardize, come to a consensus. There was quite a bit of discussions around in each individual components. But I'm wondering if you can walk us through what topics, high-level topics, we're going to be touching upon in this paper.
Exactly. We had some fantastic discussions. We were trying to find what is that standardization. Obviously, not all these have a everyone, there is still some nuance to them, and so we worked within that framework. So basically, the paper starts with looking at more or less kind of best practices and standardization of just a basic standard assessment. We then look into both the kind of rationale and protocols and what we know from things like passive leg raise or fluid bolus. From there, we move into invasive exercise hemodynamics testing. As is frequently discussed nowadays, whether it be upright or supine exercise, we do touch on the pros and cons of both of those, as well as overall with exercise, how do you approach that protocol? And what is nice is we actually have some fantastic figures that go through an algorithm of how to go from baseline to exercise, whether you go from supine then to upright or just straight to upright versus supine. And I would actually highly encourage everyone. We took all of these various protocols and put it into a poster in the supplement. There's actually 2 posters that can be printed off and are meant to be the size of a poster to be hung in the cath lab. So this can be directly for reference.
I want to emphasize that again. This is intended to be printed out, plus minus laminated, and stuck on the wall in the residents, fellows, cath lab room. So you see the cutoffs for individuals, provocative testing, drug or exercise maneuvers in different body positions. You know, what is HFpEF? What is pH? What are we calling exercise-induced pH? All of these cutoffs are individually spelled out. So you can literally print it out and post it. That's how it's intended to be done.
Exactly. And so after thinking about bolus and exercise, we then look into the various vasoactive drugs, and that's split up into basically, essentially, first is evaluation of pulmonary hypertension in patients with an advanced heart failure. We're thinking about things like transplant or LVAD, and that's looking at sodium nitroprusside and milrinone. And then we look at pulmonary hypertension and acute vasodilator testing, and that is looking, of course, at inhaled nitric oxide, inhaled iloprost, IV prostanol, and IV adenosine, and what those, and that includes both kind of the dosage, how you start, where you end, what you're looking for, indications, contraindications. Again, all of that is listed out on these, both within tables in the paper and again on this poster that can be put into the cath lab. The next step is we then go into LVAD RAM studies, LVAD reverse RAM studies, and a little bit even about exercise patients with LVADs. As we think about optimization of our patients under LVADs, we're thinking about more and more about recovery and ability to probably future explant. We're thinking about reverse RAMs. How do you assess that? There are some fantastic papers out there that look at these kind of individually, but in this case, we were able to collate all those and kind of put them into context, and again, include them here in our figures and tables.
So this compendium sounds like a lot of work. It was a lot of work to put it together, but it's only 14 pages without the references. And again, look at the supplement. This is manageable. This is going to be a reference document going forward for you. And all the things you always wanted to ask somebody, but you don't know who to ask, now you can just look it up for hemodynamic testing in the cath lab. Trust me, I have to ask all the time too. But, I have Mark on speed dial. You can have me and Mark on speed dial. You just look it up 24/7.
Well, thank you for listening, and most importantly, we want to thank all the co-authors for their incredible time and contribution to this. It was awesome to have the opportunity with Marat to lead this, but this wouldn't have happened without really all the expertise, as much from around the world, that went into creating this.
Yes, thanks everybody, and happy reading.